Folks, this is Dr. Parin Makadia, and I'm co-hosting today's show with Dr. Silvi Simon. We are live in the studio discussing high blood pressure with a group of nephrology fellows. For the last half of the show, our guests are Dr. Karendip Braich and Dr. Jeet Gandhi. Folks, the number to the studio again is 972-235-5555, and to be part of the conversation and to ask questions to our expert, please call that number. Dr. Braich and Dr. Gandhi, welcome to Doc Talk Live, and thank you very much for volunteering your time to be part of this show. Please tell the listeners a little bit about yourself.
Hi, I'm Karendip Braich. I'm visiting from New York. I'm graduating fellow at Mount Sinai. Thank you for having us here.
Hi, I'm Jeet Gandhi. I'm one of the graduating fellows from San Antonio. I'm glad to be here. Thank you for having us. Happy to answer any of the questions.
Great, thanks for being here, guys. Well, we have questions. Let's take the first live caller. Hi, welcome to Doc Talk. What's your question? Okay, great question. Dr. Braich.
So generally, guidelines recommend that we take about 2 grams, about less than 2 grams of salt in our diet. The American diet, or even Indian, South Asian diet, we tend to have a lot more salt, so about 10 grams actually of salt in our diet. And so when you look at the labels, you should be very careful of what you take in. When you're looking on, when you see foods that are more processed, you'll find that they will have more salt in them. And generally a good guideline to go by, which one of the fellows mentioned earlier, is if the milligrams of salt is more than the calories, you should avoid it.
And Dr. Jeet?
Can I just add to what Dr. Braich said, is that generally when you're looking at the label, if your salt, if you see the sodium is more than 300 milligrams, you should be avoiding that. 2 grams of sodium, and equivalent of that is about 5 grams of salt. That's what you should aim at. Anything which you eat outside in the restaurants, as Dr. Ginsburg said earlier, has loads of salt. What I tell my patients is, if it tastes good, then it has a lot of salt in it.
All right, let's take another live caller. Well, actually, going back to one of our callers over the break, he had also mentioned that a very good point is that his father has high blood pressure, and he does not currently, but he's wondering if he's at risk to get it. So is hypertension hereditary? Dr. Gandhi?
So that's a great question, and it can be hereditary. You do need to get yourself checked at an earlier age than usual. I would recommend to get your blood pressure checked almost on a yearly basis, annual checkup after you're 35, and it depends on what age your father inherited the blood pressure, the high blood pressure as well.
Great. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
When it comes to salt, it's generally the types that you find at the grocery store. It's about the sodium content. So no sea salt versus the kosher salt versus whatever you find. It's all about the same.
Yes, Dr. Gandhi?
So you can also use alternatives to salt as well. Like you have Mrs. Dash, and I generally tell my patients use Mrs. Dash Herbal, because a lot of the herbal products don't have potassium in it, which is very important for chronic kidney disease patients as well. You can use Mrs. Dash as well, so but if you don't have any chronic kidney issues as well.
Thank you. Let's take another live caller. Hi, welcome to Doc Talk. What's your question?
Actually, the normal blood pressure range is 120/80, so anything higher than that becomes hypertension, and then there are stages of hypertension. Welcome to Doc Talk Live. Your questions for our expert. Yes, welcome to Doc Talk Live. Sure. Sure. Thank you for your call. Uh-huh. Sure. So we'll address both questions. Dr. Braich?
Okay, so with regards to your father and his blood pressure being sometimes 150s and then coming down to, 80s, and if he's being treated with medication, that is something that medication is supposed to do. However, sometimes medications can drop your blood pressure too much if your dietary, if you're adjusting your diet for your blood pressure, if you're losing weight, those kind of things can make your blood pressure come down, and maybe your blood pressure medication dose is now too high for your blood pressure when it's been adjusted for certain factors. With regards to your blood pressure being high, when you say coming here, I assume that you mean moving to the U.S. The American diet has a lot more salts than your diet probably had back home, and that could probably be contributing to it. As you get older, your blood pressure can also fluctuate, so that can also add to it.
Okay, let's take another live caller. Hi, what's your question? Gandhi, would you like to address that?
Sure. So, assuming that you're taking your metoprolol and there is no interaction between metoprolol and CoQ10, is there any specific reason? I don't know why you're taking the CoQ10. It's basically taken with statins that for your high cholesterol, but I don't see, I don't know of, or I've not heard of any interaction between metoprolol as well as CoQ10.
Thank you, Dr. Gandhi. Let's take another live caller. Hi, what's your question? Great question. Dr. Braich?
Oh, so I think silent killer, because for a lot of patients, a lot of people, if you're not visiting your doctor, if you're not checking it, your blood pressure can slowly be creeping up over the years, and you can end up in this 150, 160 range without having any notice of it. And the reason that we worry about high blood pressure is because of things like heart attack and stroke. So you want to get, you want to manage these things, and if you're not, you're at more risk for the higher risk for these.
And not to mention
conditions.
chronic kidney disease.
Oh, and chronic kidney disease.
Okay, let's take another live caller. Hi, welcome to Doc Talk. What's your question? Good question. Dr. Gandhi.
So yes, the answer to your question is not as simple. If you are on telmisartan, which is a great blood pressure medication, you need to regularly monitor your blood pressure and follow up with your doctors and let them know. They can always adjust your dose. If you make some life-changing modifications to your diet, as well as you exercise on a regular basis, there's a chance that they could potentially get you off the medications, but it has to be done under the supervision of your doctors for sure.
Great point, Dr. Gandhi. Let's take another live caller. Hi, what's your question for our experts? Okay, thank you. Dr. Gandhi?
So it's probably a myth that people have mood swings or they have anger issues with high blood pressure. There are some side effects of certain medication which could bring more irritability, but that's a very, very small percent, less than 1% chance. But there is absolutely no data or no research which says that there is any kind of mood swings or irritability as far as blood pressure is concerned.
Thank you, Dr. Gandhi. Let's take another live caller. Hi, what's your question? Tom? Yes. Good.
Okay, so the way that we check blood pressure in the office is the most accurate way that we have at this time. It can vary day to day, and it should vary day to day because your blood pressure is supposed to fluctuate for your body's needs. Yeah, in the office, the way they take it is the most accurate way. It can be lower at home, sometimes higher in the office, but I don't think you should doubt the way that we're checking it when they put the cuff on and all of that. We do recommend that you tend to be calmer and quieter, more relaxed when we take it, because that can affect it, but I wouldn't doubt it so much.
Dr. Gandhi,
I just wanted to add to Dr. Braich that generally when they check your blood pressure in the office, they need to, you need to be calm for at least 5 minutes before you take the blood pressure. Generally what they want is they want you to monitor the blood pressure at home, which is a little bit more accurate than what they take at the doctor's office, only because there is something called as white coat hypertension, which is basically anxiety when you see a doctor. It's always good to monitor your blood pressure at home and maintain a log for it.
Okay, let's take another live caller. Hi, what's your question? Can high blood pressure cause blood clots?
So blood pressure, as in you mean blood clots, there are different kinds of blood clots, and it can cause, high blood pressure can make your arteries more stiff, and it can block your arteries. But as far as causing clots in your legs or clots in the lung, that's not. There's no data on that as well.
Thanks. Let's take another live caller. Hi, welcome to Doc Talk. What's your question? Hi, welcome to Doc Talk. What's your question? Okay, well, we have about 1 minute, Dr.
Sure, so we get 81 milligrams of aspirin is prescribed mainly so that it can help keep your blood a little bit less thick, so to speak. And that will actually help with your circulation. It's not necessarily impacting your blood pressure, but the consequences of sometimes having high blood pressure.
So we have about 30 seconds or so remaining. What would you give our listeners advice about blood pressure if you were to send out a last message?
Try and watch your diet, try and be healthy, lose weight, exercise.
Watch the labels on the back of the food you buy from the grocery stores. Don't eat processed food, eat less fast foods. Monitor your blood pressure, even if you're younger. It's always good to be on the safer side. It's better to be safe than sorry.
Excellent. We had a great discussion today talking about blood pressure, and we thank our guests coming on our show from across the country. This is Dr. Makadia and Dr. Simon signing off. Stay healthy, DFW.
Woohoo!